The chia seed recipe that destroys diabetes, cleans your arteries, and saves your heart. Picture this. You are at your doctor's office 5 years from now, and your physician is looking at your test results with genuine amazement. Your blood sugar readings show remarkable stability, your cholesterol levels have improved significantly, and your energy feels more consistent than it has in years. What if I told you this transformation could begin with a tiny seed that has been scientifically proven to support metabolic health, combined with 3 simple ingredients that work together to create measurable improvements in diabetes management and heart health? Today, we are exploring a recipe backed by actual research studies and clinical trials. Not trendy superfood claims, but real science that shows how these 4 ingredients work synergistically to support your body's natural regulatory systems. This is not about miracle cures or replacing medical treatment, but about understanding how evidence-based nutrition can complement your health journey, the science behind these ancient foods. For thousands of years, indigenous communities recognized the power of certain foods to sustain health and energy. The Aztec and Mayan civilizations valued chia seeds so highly they used them as currency and considered them essential for warriors on long journeys. What they discovered through empirical observation, modern science is now validating through rigorous clinical research. The recipe we are discussing today combines chia seeds with Ceylon cinnamon, apple cider vinegar, and raw honey. Each ingredient is backed by peer-reviewed studies showing specific benefits for blood sugar control, cardiovascular health, and metabolic function. What makes this combination particularly powerful is how these ingredients work together, creating synergistic effects that exceed what each could accomplish individually. Recent research has revolutionized our understanding of how specific food combinations can influence glucose metabolism, inflammation levels, and insulin sensitivity. The key is not just adding healthy foods to your diet. It is understanding how they interact to support your body's complex regulatory systems. Next, understanding your body's daily metabolic challenges. Every day, your body navigates a complex series of metabolic processes that determine your energy levels, blood sugar stability, and long-term health outcomes. After meals, your blood glucose rises, triggering insulin release to help cells absorb this energy. However, factors like stress, processed foods, and sedentary lifestyles can disrupt this delicate balance, leading to insulin resistance and chronic inflammation. A comprehensive systematic review and meta-analysis of 14 randomized controlled trials with 835 participants found that chia seed consumption results in notable decreases in systolic blood pressure, total cholesterol, LDL cholesterol, and triglycerides. These are objective, measurable improvements in cardiovascular risk factors that occur independent of other dietary changes. The timing and combination of nutrients can significantly impact how your body processes glucose and manages inflammation. Research demonstrates that certain compounds can slow glucose absorption, enhance insulin sensitivity, and provide sustained energy release, all crucial factors for preventing the blood sugar spikes and crashes that contribute to diabetes progression. Next, the remarkable science of chia seeds. Chia seeds, scientifically known as Salvia hispanica, pack an extraordinary nutritional profile that makes them uniquely suited for metabolic health support. University of Toronto researchers found that people who consumed 30 grams of chia seeds daily over 6 months lost 4 pounds compared to weight loss of about half a pound for the control group while maintaining good blood sugar control. A clinical study on 32 patients with non-alcoholic fatty liver disease found that chia supplementation 25 grams per day for 8 weeks promoted increases in plasma alpha-linolenic acid and fiber consumption and a higher number of endothelial progenitor cells. These results indicate improvements in cardiovascular function at the cellular level. What makes chia seeds particularly valuable for diabetes management is their exceptional fiber content. Chia seeds contain 34 to 40 grams of dietary fiber per 100 grams, which is equivalent to 100% of the recommended daily intake for adults. This fiber forms a gel when combined with liquid, which dramatically slows glucose absorption and helps prevent blood sugar spikes. The omega-3 fatty acid content in chia seeds is remarkable. Research shows that chia seeds contain the highest concentration of omega-3 fatty acids of any plant food with a nearly perfect omega-3 to omega-6 ratio that supports anti-inflammatory processes throughout the body. These fatty acids play crucial roles in reducing inflammation and supporting cardiovascular health. However, it is important to note that while chia seeds show promise, the research has some limitations. A recent meta-analysis concluded that chia consumption may not have a significant impact on reducing fasting blood glucose levels, insulin, and HbA1c levels, highlighting the need for further research with larger sample sizes. This emphasizes that chia seeds work best as part of a comprehensive approach rather than as a standalone solution. In patients with early-stage diabetes, chia supplementation favored healthier adipose tissue and improved glucose metabolism through enhanced beta cell function. These improvements suggest chia seeds may help prevent diabetes progression in at-risk individuals. Next, Ceylon cinnamon, the blood sugar regulator. Ceylon cinnamon, distinct from the more common cassia cinnamon, has been extensively studied for its effects on glucose metabolism and insulin sensitivity. The research on cinnamon presents a mixed but intriguing picture of its potential benefits for diabetes management. A groundbreaking study published in Diabetes Care found that people with type 2 diabetes who consumed 1 to 6 grams of cinnamon daily experienced reductions in serum glucose, triglyceride, total cholesterol, and LDL cholesterol levels. The study demonstrated that these effects persisted even 20 days after participants stopped consuming cinnamon, suggesting sustained metabolic benefits. A comprehensive meta-analysis of 16 randomized controlled studies found that cinnamon significantly reduced fasting blood glucose and homeostatic model assessment for insulin resistance levels compared to placebo. The analysis showed weighted mean differences that represent clinically meaningful improvements in diabetes markers. However, the research is not universally positive. A controlled study of 60 type 2 diabetes patients found that using cinnamon for 60 days did not change glucose levels, leading researchers to conclude that more studies are needed before recommending cinnamon for diabetes management. This highlights the importance of viewing cinnamon as a supportive ingredient rather than a primary treatment. The first U.S. study to evaluate cinnamon's effects on blood glucose and lipid levels in individuals with type 2 diabetes found no significant differences between cinnamon and placebo groups in any measured parameters. This emphasizes that results may vary based on population, cinnamon type, and individual factors. Despite mixed results, research demonstrates that cinnamon's active component cinnama may promote insulin release, enhance insulin sensitivity, and improve glucose disposal. The key appears to be using the right type, Ceylon rather than cassia, appropriate dosing, and realistic expectations about outcomes. Next, apple cider vinegar's metabolic benefits. Apple cider vinegar has emerged as one of the most consistently researched natural approaches to blood sugar management, with multiple studies showing significant benefits for glucose control and insulin sensitivity. A great assessed systematic review and meta-analysis found that apple cider vinegar significantly reduced fasting blood sugar HbA1c and increased insulin levels, while showing a dose-response relationship where each 1 ml per day increase in ACV consumption was associated with a 1.255 microgram per deciliter reduction in fasting blood sugar. A landmark study published in Diabetes Care found that vinegar ingestion raised whole-body insulin sensitivity by 34% in insulin-resistant subjects and slightly improved this parameter by 19% in subjects with type 2 diabetes during the 60-minute post-meal interval. This represents a substantial improvement in how effectively the body processes glucose. A randomized controlled clinical trial where participants consumed 30 milliliters of apple cider vinegar daily for 8 weeks found beneficial effects in controlling blood glucose indices and lipid profiles in patients with type 2 diabetes. The study was particularly well designed using homemade apple cider vinegar to ensure quality and consistency. The mechanism behind apple cider vinegar's benefits is well understood. Researchers found that apple cider vinegar significantly lowered post-meal blood glucose levels when consumed 20 GI before a meal, with effects measured at 30 and 60 minutes after eating. The acetic acid in vinegar appears to slow gastric emptying and improve insulin sensitivity in muscle tissue. A 2021 meta-analysis published in BMC Complementary Medicine and Therapies found that consuming apple cider vinegar reduced fasting blood glucose by about 8 mRs per deciliter and was most pronounced in people with type 2 diabetes who consumed up to 15 ml per day for more than 8 weeks. Next, raw honey, a controversial but researched addition. Including honey in a diabetes-focused recipe might seem counterintuitive, but research reveals that high-quality raw honey has different metabolic effects compared to processed sugars. Though this remains a complex and debated topic, research conducted at the National Institute of Diabetes in Cairo, Egypt, found that when honey was compared to glucose and fructose, the glycemic index and peak incremental index were lower in both diabetic patients and healthy controls when honey was used. However, this does not mean honey is recommended for all diabetic individuals. Raw honey typically has a glycemic index ranging between 50 and 60, compared to table sugar's glycemic index of 68, with variations depending on the floral source. Acacia honey can have a GI as low as 32, while Tupelo honey can reach 74. This variation highlights the importance of honey type and quality. A Turkish study found that people with type 2 diabetes who ate 5 to 25 grams of honey daily for 4 months reduced their hemoglobin A1C, but those who consumed higher amounts saw their A1C levels rise. This demonstrates that with honey, less is definitely more. A randomized controlled crossover trial with 53 patients with type 2 diabetes found that consuming 50 grams of honey daily for 8 weeks resulted in significant weight reduction, but also showed some concerning effects on glycemic control. This study highlights why honey amounts must be carefully controlled. The fructose content of honey varies from 21 to 43%, with a fructose to glucose ratio from 0.4 to 1.6. And although fructose has a glycemic index of only 19 compared to glucose's 100, the total composition determines honey's metabolic impact. The small amount used in our recipe takes advantage of honey's lower glycemic response while minimizing total carbohydrate load. It is crucial to understand that due to the limited number of studies, no definite conclusion can be drawn regarding the effects of honey on glycemia in diabetic patients, and large population-based randomized control trials are needed. The honey in this recipe serves primarily as a palatability enhancer while providing trace nutrients. Next, the complete evidence-based recipe based on the available research. Here is the carefully formulated recipe that balances potential benefits with safety considerations. Ingredients: 2 tablespoons organic chia seeds, 1 teaspoon Ceylon cinnamon powder, 1 tablespoon raw apple cider vinegar with the mother, 1 teaspoon raw unprocessed honey, 8 to 10 oz filtered water, optional juice of half a lemon for vitamin C and enhanced flavor. Preparation method: begin by combining the chia seeds with 4 oz of water and allow them to sit for 15 to 20 minutes until they form a gel-like consistency. This pre-oaking is essential as it activates the fiber and makes nutrients more bioavailable while preventing the seeds from swelling in your digestive tract. In a separate container, dissolve the honey in the remaining water. Then add the apple cider vinegar. Mix the cinnamon into the chia gel, stirring thoroughly to distribute evenly. Slowly combine the vinegar mixture with the chia gel while stirring continuously to prevent clumping. The order of combination matters both for texture and nutrient preservation. Pre-oaking ensures the chia seeds are fully hydrated and safe to consume. Dissolving honey separately prevents crystallization, and adding cinnamon to the gel helps achieve even distribution throughout the mixture. Next, optimal timing and realistic expectations. Research suggests consuming this type of mixture 15 to 30 minutes before meals can maximize blood sugar regulating effects, as this timing allows the fiber and acetic acid to begin forming a protective gel in the stomach before glucose from the meal arrives. For optimal safety and effectiveness, consider consuming this mixture once daily, preferably before your largest meal of the day. Studies show that greater effects on fasting blood sugar occur with apple cider vinegar dosages greater than 10 ml, but doses should be gradually increased to assess individual tolerance. The research indicates that benefits accumulate over time rather than providing immediate dramatic changes. The University of Toronto's study showing weight loss and diabetes benefits with chia seeds required 6 months of consistent consumption, emphasizing the importance of patience and consistency. It is crucial to understand that individual responses can vary significantly based on genetics, existing health status, medications, and overall dietary patterns. The significant heterogeneity observed among chia seed studies warrants further clinical trials and suggests that responses may vary considerably between individuals. Next, important safety considerations. While these ingredients are generally recognized as safe, there are important considerations for certain individuals. High heterogeneity observed among cinnamon studies warrants caution, and standardization of formulations is needed for consistent results. People taking diabetes medication should monitor blood sugar more frequently when beginning this regimen, as the combined effects may enhance medication effectiveness. Apple cider vinegar's ability to improve insulin sensitivity by 34% in insulin-resistant subjects suggests it could potentially interact with diabetes medications. The Harvard School of Public Health notes that people with dysphagia or digestive issues should eat chia seeds with care, and they should always be soaked in liquid before consumption to prevent blockages. Never consume dry chia seeds. Those with gastroesophageal reflux disease should use caution with apple cider vinegar, as the acidic nature may worsen symptoms. Always dilute vinegar and consider starting with smaller amounts to assess tolerance. Next, the role of a comprehensive lifestyle approach. This recipe represents one tool in a comprehensive approach to metabolic health. But research consistently shows that the greatest benefits occur when dietary interventions are combined with regular physical activity, stress management, adequate sleep, and ongoing medical care. The systematic review of chia seed studies noted that benefits were most pronounced when seeds were consumed as part of broader healthy lifestyle patterns. No single food or recipe can replace the importance of overall dietary quality and lifestyle factors. Harvard researchers emphasize that chia seeds do not act alone to benefit human health, but may contribute to disease prevention when incorporated as part of a varied plant-rich diet and other healthy lifestyle behaviors. Regular monitoring of key health markers, including fasting glucose, HbA1c, blood pressure, and lipid profiles, provides objective feedback on the effectiveness of dietary and lifestyle interventions. These measurements are more reliable than subjective feelings for tracking metabolic improvements over time. Next, practical implementation strategies. Success with this recipe lies in making it a sustainable part of your daily routine rather than a temporary intervention. Research shows that people who successfully maintain health improvements view them as permanent lifestyle changes rather than short-term fixes. Consider preparing larger batches and storing individual portions in the refrigerator. The mixture actually improves in texture and flavor after several hours as the ingredients melt together, making batch preparation both practical and convenient. Start with smaller amounts initially to assess your body's response. While the research supports these ingredient safety for most people, individual tolerance can vary. Pay attention to how you feel and any changes in your energy levels, appetite, or digestive comfort. Keep a simple log of your blood sugar levels if you monitor them, energy levels, and overall well-being. This personal data can help you determine whether the recipe is providing benefits and guide any necessary adjustments to timing or ingredients. The research supporting these ingredients comes from peer-reviewed journals and reputable scientific institutions worldwide. While no single food combination can guarantee specific health outcomes, the evidence suggests that this recipe may offer meaningful support for cardiovascular and metabolic health when used as part of a comprehensive approach. The beauty of this evidence-based recipe lies in its accessibility and affordability. These are common ingredients available in most grocery stores, requiring no special equipment or complicated preparation methods. The cost is minimal compared to supplements or processed health foods, making it sustainable for long-term use. Most importantly, this recipe represents a bridge between traditional food wisdom and modern scientific understanding. What traditional cultures knew empirically about these foods, we can now understand through rigorous research methodology, giving us confidence in both the safety and potential efficacy of this combination. As you consider incorporating this recipe into your health routine, remember that consistency and patience are more important than perfection. Even consuming this mixture several times per week may provide benefits, and you can always adjust the frequency based on your preferences, tolerances, and response. Your journey toward better metabolic health does not require dramatic changes or expensive interventions. Sometimes the most powerful improvements come from simple evidence-based choices that work with your body's natural regulatory systems. This chia seed recipe represents exactly this kind of approach. Scientifically grounded, practically achievable, and potentially beneficial for long-term health. As we move forward, it is important to place this discussion within a broader scientific and human context. Nutrition science is not static. It evolves as new methodologies, longer studies, and more diverse populations are examined. What remains consistent, however, is the growing recognition that food is not merely fuel. Food is information. Every ingredient you consume sends signals to your cells, your hormones, and your immune system, influencing how your body responds to stress, repairs damage, and maintains balance over time. One of the most powerful insights emerging from modern research is the concept of metabolic flexibility. A metabolically flexible body can efficiently switch between energy sources, maintain stable blood sugar levels, and respond appropriately to insulin signals. Chronic metabolic diseases develop when this flexibility is lost. The foods discussed in this recipe are repeatedly shown to support pathways associated with improved metabolic signaling, reduced oxidative stress, and healthier inflammatory responses. This does not happen overnight, but gradually through consistent exposure to supportive nutritional inputs. Another critical dimension is vascular health. The heart, brain, kidneys, and every other organ depend on healthy blood vessels. Inflammation, oxidative damage, and lipid imbalance slowly degrade the inner lining of arteries long before symptoms appear. Research on chia seeds, cinnamon, and apple cider vinegar repeatedly points toward improvements in endothelial function, lipid transport, and blood pressure regulation. These are foundational processes. When vascular health improves, the benefits extend far beyond glucose control, influencing cognition, physical endurance, and long-term resilience. It is also worth addressing expectations shaped by modern culture. Many people are conditioned to look for dramatic, immediate results. Science tells a different story. Meaningful health changes are usually subtle at first. Small reductions in post-meal glucose spikes, slight improvements in lipid ratios, gradual reductions in systemic inflammation over months and years. These small changes compound, shifting disease trajectories in a measurable way. This is how prevention works. Quietly, steadily, and often unnoticed until outcomes are compared over time. Equally important is the psychological relationship with health interventions. When an approach is simple, affordable, and grounded in everyday foods, it is more likely to be sustained. Sustainability is not a minor detail. It is the central determinant of long-term outcomes. The research literature repeatedly shows that adherence, not intensity, predicts success. An intervention that is biologically sound but abandoned after a few weeks offers little benefit. An approach that becomes part of normal life, even if modest, can reshape health markers over decades. This is where traditional knowledge and modern science intersect in a meaningful way. Ancient cultures did not have randomized controlled trials, but they had generations of observation. Foods that sustained energy, reduced illness, and supported endurance were preserved and passed down. Today, laboratory analysis and clinical trials allow us to understand why those observations were valid. Fiber viscosity, polyphenol activity, fatty acid ratios, and enzymatic interactions now explain what was once attributed to experience alone. It is also essential to maintain intellectual honesty. No recipe, no matter how well researched, is a guarantee. Biology is complex and human variability is immense. Genetics, microbiome composition, environmental exposures, and life history all shape individual responses. Science does not promise certainty. It offers probability. The evidence discussed throughout this speech suggests a favorable probability of benefit when these foods are incorporated into a broader pattern of health-conscious living. From a public health perspective, approaches like this matter because they are scalable. They do not require advanced technology, specialized clinics, or high financial investment. They can be implemented across socioeconomic boundaries, offering potential benefit in communities where access to medical resources may be limited. This is one reason nutrition research remains a cornerstone of preventive medicine worldwide. As research continues, future studies may refine dosages, identify responder profiles, and clarify long-term outcomes with greater precision. Biomarker-driven nutrition, personalized dietary recommendations, and deeper insights into gut microbiome interactions will further expand our understanding. What will likely remain unchanged is the principle that whole, minimally processed foods with demonstrated biological activity form the foundation of metabolic health. In closing, this discussion is not about chasing health perfection. It is about informed choice. It is about aligning daily habits with what science increasingly understands about human physiology. When knowledge replaces guesswork, confidence replaces confusion. Each evidence-based choice, no matter how small it seems, contributes to a larger pattern that shapes health over time. The story of this chia seed recipe is ultimately a story about empowerment. Not empowerment through extremes, but through understanding. When you know why something works, you are no longer relying on hope or hype. You are participating in your health journey with clarity and intention, guided by both ancient wisdom and modern science, working together toward the same goal. The convergence of ancient food wisdom with modern scientific validation provides a solid foundation for incorporating these ingredients into your daily routine. Every time you prepare this recipe, you are making a choice supported by both historical use and contemporary research, a powerful combination for supporting your metabolic health journey. If this evidence-based approach to nutrition was helpful, please type yes in the comments below. Your feedback helps us create more content that bridges rigorous science with practical everyday health solutions.